And yes, the last one. So this is not going to cover vaccines, but perhaps a really good introduction to some of the work that Beth will present after lunch for us. We included it here because this is the objective, one of the objectives that we want with our vaccines, collaborative supply planning work, and standardizing government structures and processes into one thing is from what we've learned from the global family planning visibility and analytics network over the last decade or so. We have been working under a very separate data sets. And just to say that the Gates Foundation in 2012 negotiated a volume commitment with Merck and Bayer pharmaceutical manufacturers for a certain contraceptive, which is a contraceptive long-term method called implants, which is usually a plastic mixed with a hormone rod that gets placed underneath the skin. For the Merck product, it lasts about 3 years. It's 1 rod. For the Bayer products, it's a 2-rod implant that lasts about 5 years. But the costs of this contraceptive were so high that it limited its access to these lower middle income countries. They negotiated a volume agreement to lower the prices, but it also guaranteed a commitment for procurement to these manufacturers for a certain volume per year. And then they came to JSI to help monitor whether or not those manufacturers were meeting those agreements, and negotiated kind of an auditing process with JSI to monitor those volumes, which then allowed us to have 100% visibility into this data. Historically, as you had seen in the earlier presentation, the procurement for these products were coming through either the USAID agency, through UNFPA, and then a smaller subset, 5 to 15% of those volumes were coming through organizations that were INGOs who were working with social marketing type organizations who were catering to this non-public sector, but not quite private sector users who were coming in to get their contraceptives through them. Kind of like a Planned Parenthood organization or such in the United States as we know them. And the market was kind of, the data sharing was not completely there, but we finally had complete visibility and started seeing that through this information that both procurers, for example, were buying a certain amount to the same country who didn't appear that they would need it, and just sharing back that information, letting them know, hey, did you know so-and-so is also doing the procurement? Maybe you don't need yours, they need theirs. Let's figure out how to equitably distribute this information, not making the decision for them, but giving them the information that they would need in order to be able to do that. And at the same time, as we had said before, the information systems were increasing, there was greater visibility. And what we saw was that there was a need to use this kind of 100% forecast, 100% visibility that we had to this marketplace to develop something that was a replicable methodology for helping not just the procurers combined for all USAID and UNFPA to have one forecast, not just their separate disaggregated forecasts, but to have one forecast and to share that out with the manufacturers as well. Because what we were starting to see was the success of the program actually meant that the commitment that was made was lower than the demand that it started to produce, and that the manufacturers were actually not producing as much of the demand that we saw for these products happening. We wanted to prove our methodology through what was becoming a new platform for the VAN, and to be able to then incorporate that new methodology into the VAN so that it could be replicated for all the other contraceptives out there. And perhaps as we get to have a vaccine VAN or an antiretrovirals VAN or other product VANs that are getting to this point of standardized processes globally, we can adopt that method then to those product areas as well. And so let's just, I've taken out all the volume information, but you can see the trends. Since there are only just 2 or 3 for implants, it would give away market information, which we are not allowed to do. So you can see in 2013, when these agreements were signed, product A, B, and then a new product market started becoming more and more viable because the demand again wasn't being met. So product C started coming into the market, and we were seeing these up and down demands for these products. What we started doing was trying to use this data to extrapolate across the total. So we looked at what the countries were reporting as their supply, the procurement plans for the near term. So they usually submit to the platform 18 to 24 months of their procurement plan. So they'll say in January, we have a desire to procure this much in order to have enough product in stock to meet our down supply chain resupply needs. We understood that there were 16 to 18 countries that were historically pretty good about what their supply plans represented. They're pretty accurate in terms of measuring what their demands were. And we had up to 2018 some historic information on what actually had been procured. And so we took that information, the volumes projected by those 18 countries that represented a certain volume of the historic marketplace, and extrapolated that going forward to show what we thought the demand would be. We did also try exponential smoothing on that, but then retrospectively reviewing back, the mean absolute percentage error, which was the accuracy measurement that we were using, showed that the extrapolation method was actually more accurate than the exponential smoothing method. So we eliminated that from our future methods. And so looking at how to extrapolate this information, that the plans from those 16 to 18, 19 countries out of the 69 actually represented a very large volume of the marketplace. So you can see over the years for product A, 70 or so of the total market. And then for product B, a greater range between 60 to 80. And product C really wasn't part of the marketplace until 2018, 2019, 2020. So it's not factored in here. And we looked at a couple of different averages. So using a cumulative average to extrapolate, a rolling 2-year average, and then a naive one. And that's where we used the MAPE to determine which was more accurate. And so you can see in terms of the range of representation in these pie charts, and product C, as that data came along, it represented 62 to 84. And so let's look at the forecast for product A. As I mentioned earlier, the demand wasn't being met. So we've had a pretty good success from 2013 when those agreements were signed for those large procurement volumes. By the time we got to 2018, they weren't enough in the marketplace to meet the demand from the countries. That actually had taken up pretty good. The women were choosing this method. It wasn't something that was available to them before, and there wasn't enough of the product available for procurement. And really having the van then put us in a great position to have to monitor all the country different supplies and try to figure out how to equitably distribute what was available and kind of hold countries to their minimum volumes required to allow all of them to have some level of product. So that visibility allowed us to be able to do some of that information sharing, to be able to equitably distribute some of this product across the procurers and the countries. But the interesting pattern here, and you'll see it in both products A and products B. Let's see. Does this work? No. So the shaded area represents the actual. The 3 lines for each of the different colors represent the different forecasts using the different averages. Over a year in advance, they're closer to being accurate. So if I'm in 2018 and I'm forecasting for my total procurement for 2019, I actually start out doing a pretty good job. But as the country realizes that they're not going to get their supplies, they start shifting their volumes that they're not going to get in 2018 out to 2019, and the gap starts to increase in 2019 to become a higher level forecast in 2019, because I still need to fill my pipeline. There's still the demand, it's just transferring that demand further and further out. So that rise in the forecast increases at the beginning of 2019 and at the first quarter or two of 2019, and then drops when they know they're actually not going to get what they had hoped. So they keep shifting this out, and that gap starts to increase year over year. The gap difference between the actual and the demand here in the forecasted demand is less. In the second year in the pink, it actually becomes more, because the need is still there for the women there, and the pipeline is being filled less and less in the supply chain. In order to fill that up, they need more and more product to come in. And so it's just shifting the product out. And you can see that huge difference in this cyclical pattern of funding and demand that's happening with the gray and pink lines. As they start seeing they're not going to get their products, they get closer to the actual. The other forecast for the future goes up higher. As they figure out what they're going to get, it switches in terms of the relationship. And here we see the same pattern again for product B, which has less demand, which is, and then you see that bump when they are shifting the product out, and then the gap increasing year over year. And then we see the product C demand. There was actually an unknown capacity for product C because they hadn't negotiated a volume agreement for production with the Bill and Melinda Gates Foundation. And so this unknown capacity just allowed the countries to shift their demand more and more to product C, not knowing whether they would actually get it or not. And so the accuracy follows a similar relationship. So we measured our accuracy using the MAPE. Starts out low when you're more than a year away from the procurement period. It increases early in the procurement year, but as soon as they find out what they can actually get, it drops to become more accurate. I mean, if we wanted to do the most accurate forecast for what would actually be procured, we would just have them be the volume that was available from the manufacturer that it was negotiated with. But one of the points of doing this forecast of the demand was to show the manufacturers that they could actually increase the capacity for production, showing them what the volume for this marketplace was, that if they invested in their production lines and increased it to something that would be predictable, they wouldn't see this kind of rolling, pushing the product out further and further and increasing the demand. And it's what would be really difficult then for them. One of the comments that we heard is, once you do feed the demand, then what would the next year's forecast be, right? So if you do fulfill the gap that's there, what would be the new baseline that we would be sitting, which would be hard to do because right now there's such a high unmet need. And we're not really sure how that affects the behavior of women who come in, or the behavior of the providers who are trained to give this certain product, when you continuously have to ration the product or continuously have to be told it's not available or can't get it in the time that you want it. How does that influence then the demand of the product in the future, which is harder for us to judge. So some of the limitations for this is that it assumes that we're the same proportions that were available or procured in the past would follow. Again, we're not sure based on some of the behaviors that are happening. The quality of the procurement plans that we're getting from the countries varied. Obviously, the more near term that forecast was, the more accurate it is. Some of them, the further out they went into the 18 or 2-year forecast, less and less accurate or even available. So some countries would report a really good forecast for the next 12 months, but then not even report for those quarters after that. And so our proportions decreased through time and more of the assumption being applied. A lot of this is dependent on, because the majority of those procurements are through USAID and UNFPA donations based on the cyclical process for those forecasts. The historic shipment quantity higher We don't know because it has been constrained. And they really, because they don't always have the incentive in this marketplace to produce anymore. Those prices were negotiated to give them minimal amount of profit, just enough to be able to have production for this marketplace. It's not marked up to the levels that you see in other countries. Like the United States has the highest prices for pharmaceuticals in the world. And so in comparison, it's not really favorable for them to expand their production lines to meet the demands for this market. And we've seen that in other products for contraceptives. The injectable products for injectable contraceptives are the same lines that Pfizer uses for COVID-19 vaccines. And so, you know, they can make a lot more money procuring and manufacturing COVID-19 vaccines versus a new product for injectable contraceptives. And I think that's it. So what the hope is that we've introduced a methodology that it's taken up by the global FP-VAN as something that's not manual, because this has been a manual process and it stopped in mid-2021. I did the last one then, and we were hoping that then it gets adopted as a something that's a programmable within one of the functions of the ERP system that's hosting the FP-VAN, and then it can be applied to all of the other contraceptive methods. And the goal, one of the goals, if we have a vaccine collaborative supply planning approach where we now have all of that in one platform. Right now, I believe we have 11 of the 21 countries in the vaccine initiative that make up 80% of the vaccine volume. So if we can prove that this, you know, approach works, although it had high, very high error rates, it's still something that is replicable and can be used. We could, if we standardize this process for vaccines and have standardized data sets, that we could then apply the same extrapolation forecast out, because we are getting supply plans that are increasing in quality and representative that then we could use. Okay. And I will pause there for questions. Yes, Fahma. Yes, so we were in every quarter we would present the forecast to them. The folks that we would talk to would be like global, part of their global team who were the sales folks to these countries and to these kind of institutionalized procurers is what they're referred to. So the USAID and UNFPA representatives and the folks who were sitting on the boards for the commitments that were made with the donors, which I should have included the governments of Norway, Sweden, and Children's SIF, which is a UK-based organization that provides aid to children-based programming around the world. There were meetings for this consortium of folks who had made these agreements, and we did have communication with the manufacturers. Often they're not in a position to make those decisions on expanding their manufacturing lines, right? And so they're limited to the kind of influence they have, because those are business decisions made by those pharmaceutical companies. And again, there are, you know, risks and benefits to transitioning a manufacturing site, and a lot of capital that's required to transition to another product, and you do need guaranteed volumes year over year. What we were showing is only 18 to 24 months, but consistently showing that there were higher demand than they were being met, that they were meeting. It just, you know, if they're making minimal percentage profit over that product based on that negotiation, and if they could hold out to have another commitment by another donor, then why not, right? There's other considerations for the kinds of decisions that they're making. And the commitments were only through 2018. And it's one of the reasons why we started the forecasting, right? They didn't have to have a commitment past the 5-6 years that they decided to do that for. They've done it out of the goodness of their heart to extend the pricing, but no more really information on the volumes, but we just, yeah. I wonder, yes.
So I just noticed one interesting point in your slides. So you mentioned that the forecast is made in the middle of the year, which is relevant for the next 18 months. So including 1.5 months. Yeah. So I was wondering whether you revise your forecast when there are more data become available. For example, at the end of the year, you found that okay, some of the backlog clear out, and then
It never got cleared out. The backlog just kept getting pushed further and further out.
okay, so maybe the opposite way. The backlog is never clear out. Maybe there are higher backlogs. So at that point, you can revise your forecast for the next year because your forecast is based on more recent data. So I was wondering whether such forecasting revise is conducted or not.
So we did redo the forecast every quarter, and the methodology was the same, where we reviewed the country's demand to project the total. So we used, you know, those countries represented 60 to 70% of the demand. We redid the forecast on a quarterly basis. It was more about, do the countries themselves, when do they find out that they're not getting what they thought they were going to get? It didn't change the demand, it just changed what would actually be shipped to them. The demand was still there. If we wanted the most accurate forecast, we would just set it at what we knew would be shipped out. What we were trying to show was that there was an increased demand for the product.
How do you forecast this demand when there is a supply chain? You have data on people that called up saying, I want this product even when it's not available.
Yeah. So some of the demographic based, so in contraceptives, you use those 3 methods that I spoke to earlier. And there is actually a lot of resources internationally used to track the women's desire for contraception and whether or not they came in and didn't get what they wanted. And so there are a lot of demographic health surveys done that maybe, I don't know, Beth, if you talk about this in your session or not, but, and if you look this up, there's a DHS, you can Google for that, and you can Google for PMA 2020 and FP 2020, who do survey of the women themselves to find out what their unmet need is and what their desire for a method is, and whether or not they've chosen a method that was maybe not their first option.
And how often are those surveys conducted?
So the DHS is done every 4 to 5 years, but the PMA is actually 2 to 3 times or 4 times a year, depending on the country. So in countries where it's high populations like Nigeria, Ethiopia, Kenya, you know, some of those key countries that represent a large volume for us and actually do a great job of forecasting, they have those more routine. And the process where we talked about combining those forecasts, right? Those committees who sit and decide and look at their consumption patterns and then look at their demographic based on those desires for choice methods will combine those 2. So that gets incorporated in the plans that we receive. The country has already discussed themselves what they anticipate their demand to be to meet the needs of not only those women who have gotten the product, but women who maybe didn't get a chance to get the product they wanted. So it is part of the forecast we get. Jerome, go ahead.
Hi, thanks. Just wondering, I'm trying to put some of those forecasting results, sort of the error results, in context with what's going on the ground. So maybe the simple question is there a threshold that you're trying to hit with MAPE by which you can say, okay, this model is good enough maybe for production, or, you know, next year I'd like to get under 10%, or something like that for some reason based on your stakeholder desires?
Not really. I mean, obviously, we would want that MAPE to be as low as possible. You know, having 100%, that's double. That's not something we would want to look for. I've seen historically people talk about 25% for global programs. I've never identified the source for that or the reason for that,
I see.
but
Okay,
it is something that's battered about.
cool.
Yeah.
Thank you. Thank you.
Okay, thank you so much.